Viewpoints on the talk station, FM 107.1. Joining us this afternoon, and we are pre-recording this portion of the program, is Dr. Randall Williams. He is the Health and Human Services Director for Carteret County and has been on the program with us in the months past, talking about, of all things, fentanyl. We're not going to, well, we may get into that issue today, the topic of drug abuse and substance abuse. Let's use that term, substance abuse. But this program today is to focus on Public Health Week, and which is starting today, as a matter of fact, and if I understand that correctly. And with that, Dr. Williams, good afternoon. Thanks for joining us.
Lockwood, thank you. The key word in public health is public, so we greatly appreciate you having us on the program to talk about that.
Well, it's not only an issue of public health, it's for those of us that don't even recognize the, well, in many instances, even the aspect of public health. We just take so many of our activities for granted. I mean, everything from assuring us that the restaurants we eat at are properly maintained and are healthy, or shall we say clean, and then you got issues associated with health concerns. Of course, most of us learned about health departments around COVID, but beyond that, there are other activities, and the purpose of this week, I guess, is to sort of designate or identify those activities.
Well, it is. I would say it's really to recognize the people who are involved in public health more than anything. And certainly, as you talk about the people, you talk about the services. So I think it's incredibly fitting that here in Morehead and Carteret County, because public health in the United States started back in 1712 around maritime communities, around the idea of quarantining ships. So all of public health in the United States started on the East Coast in towns like Wilmington and Beaufort and Charleston, South Carolina, and Boston. And so if you look at the first official act of government around healthcare was in the late 1700s when they created a hospital for sailors. Because at that time, commerce and transportation was all about ships. And so we think it's just wonderful that here in Carteret County, we're celebrating Public Health Week.
We're, again, talking with Carteret County Public Health, Health and Human Services Director. Public health is part of his responsibility, is that of Dr. Williams. You know, to your point, I find it fascinating that it was a maritime issue, I guess, relative to the possibility of ships bringing all sorts of communicable diseases ashore.
Exactly. I mean, one of my greatest possessions is a thing that washed up on the shore here on the beach in Carteret County. It's a big circle. It's got a cat on it. And people look at it and go, what it was. And the ships that used to come here, and still do to some point, have a big circle wood trap on the rope lines that go to the dock to keep rats from going up and down the lines, because that's how the bubonic plague was transmitted, on fleas and things like that. So the genesis of public health in this country started in places like Morehead City. You know, our number one role is to keep people safe in government. Government does many things, but to me, the most important role government has is to keep people safe in all sorts of ways.
Yeah, public health, you know, again, I go back to that comment. I think to a large degree, much of what we think about in public health, we take for granted.
Right.
And that is, of course, everybody's healthy. But if not everybody's healthy, then services decline. I mean, a good example of that, let me just step aside here on this one. There have been instances during COVID when whole fire departments were down with the disease.
Absolutely. And
okay.
The military certainly realizes
exactly.
that.
So, okay, well, so we got some firemen that are down with COVID and can't respond to a fire.
Right.
And if it's my house that's on fire, it's a problem for me.
Absolutely. The best way I know to frame it is that in the year 1900 in North Carolina, the average lifespan was 48 years old.
48.
It's now almost 80. So what happened in that 100 years that the lifespan in North Carolina went from 48 to 80? Was it heart transplants? Was it kidney transplants? No. It was three things. It was clean water, childhood vaccinations, and antibiotics, because the number one cause of death in the year 1900 in North Carolina was pneumonia. You don't see that much anymore because we've gotten so much better at treating the things that cause pneumonia.
All right. Again, we're talking about this being Public Health Week, but a national event, right?
Absolutely.
All right. We're going to go through some themes here in the process, but we've I think have established the justification for it right out of the gate. And frankly, the justification is not to take our health for granted.
To promote good health and keep people safe. Yes.
Right. All right. So let's talk about the structure of public health, and we'll talk about the themes. You've got a full staff. What is involved in a public health department? And of course, what's the hierarchy in this? Of course, I mean, at the local level and then a state and national level.
Yeah, I think that certainly we have a Surgeon General who had 6,000 people in his agency, and then we have the CDC in Atlanta from a federal standpoint, and all that's under Health and Human Services, which is a $1 trillion organization.
By the way, I'm always intrigued because I write it out in my stories. It's the Center for Disease Control and Prevention.
There you
but we
go.
never see the P in the
You don't.
We just see CDC.
Well, that was added on later, but you're exactly right. But, in the state, we have the Department of Health and Human Services, which is a $20 billion agency with 18,000 employees that I was blessed to be state health director of. And
That's right. You were. Let's clarify.
And I was deputy secretary of that department, yeah.
Okay. And I'm making that, moving the microphone a little bit closer.
That's fine.
That's right. You were.
Yeah, both here in North Carolina and Missouri. So did that for about 6 years.
So you worked at that high, I'm going to use that word, that state level, administrative level.
I have, but again, I think that where the rubber meets the road is at the county level, where we deliver it. So to answer your question, we're incredibly appreciative of the health department we have here. As you know, it was accredited with honors by our peers, which is a great testament to the work that Nina Oliver, our health director, and others do. I would tell you that we have a tremendous amount of experience in our department. Nina's been at this for 18 years. I've been at it now, it looks like about 40, I guess. And we have others, direct report, Jesse Dale and others that have been doing this. So we're blessed here in Carteret County intrinsically. Now, Lockwood, I include our partners in the community in public health. Asa Buck, been here a long
Sheriff's
time,
Department,
helping us tremendously with the number one challenge we face in public health right now, which is our fentanyl problem. Tracy Mancini, Community College, tremendous help, and Richie Paler in the Carteret County Schools. So I include them in our public health response.
Well, in every regard, they're a kind of a first point of contact. And plus the fact they are encompassing large numbers of a population, confined population, schools, community college, and then, as you mentioned, the Sheriff's Department. Pardon me. And the fact that they are dealing with, quite frankly, unfortunately, the impact of many of these public health issues. And of course, I'm confident the hospital is also very much on your radar as well. Absolutely.
And I think we're blessed again there. But for those of us who, a large part of public health is prevention. You mentioned the CDC added that to their name. And I think especially around the fentanyl epidemic, I was in Stanley County all day working with EMS up there. They have a really good community paramedic port team that we're interested in. And so I traveled with them. Post-overdose response team.
Okay.
Yeah.
I have a problem with acronyms. Post-overdose response team.
Yeah. But I think any of us who spend time in this space, Lockwood, just really come to appreciate how important it is to get upstream and try to prevent anybody you can from becoming addicted. It's hard not to see the consequences and not be really appreciative of our school system and our school resource officers and our community colleges to do everything they can to prevent people from ever needing a post-overdose response team.
It's an issue of education, and we'll talk about this. I think I know we will in the near term because of experiences recently, and the aspect of especially fentanyl ends with YL, so I keep wanting to say fentanyl. But also the issue now of the use of trank,
Yes.
which carries with it its own horrible
Yes.
results. I would say thank you, but not really. You shared with me a recent study on trank, and the pictures, quite frankly, were ugly.
Yes.
They're horrible. I just want to make mention of that. And in some regards, maybe that's a good thing, because if some people will see that, they will get a visual impact of what drug overdose or drug abuse can lead to, particularly with fentanyl, because of course I call that a poison, not a drug, but also the fact that people are using that with trank, which is am I correct? It's a product used for animals.
Yeah, it's an animal sedative. It's not a controlled drug because it's not intended for humans. And it just highlights the importance of working with Asa Buck and the sheriff's office in preventing, because for your listeners, trank is now being laced in North Carolina and other states because it's cheaper. It is a tranquilizer, so it makes the high last longer, but it has a horrible side effect of causing the skin in your body to slough off from the inside out, almost like a burn, and leave these horrible abscesses that have resulted in amputations. And it's turning up a lot in the drug supply because it's cheap. It's better to lace a drug with xylazine, or trank is its street name because it's a tranquilizer, than to fentanyl, because fentanyl costs more money. And of course, to Lockwood's point earlier, none of the users know what they're getting. I mean, there's no test. It's not regulated. So if their dealers say, "Gosh, I can make more money by putting this in there," which is addictive, this xylazine or trank, it's just really, really profiting from people's misery. So that's where the sheriff's office is such a valuable partner in helping us prevent that from happening.
We're talking with Dr. Randall Williams, again, Carteret County Health and Human Services Director. And after this break, I want to come back. We're going to talk about the themes. I think we hit on one of the primary themes, which was community. But we've got violence prevention, reproductive and sexual health, mental health, rural health, accessibility, food, and nutrition. More to come on Viewpoints. Viewpoints on the Talk Station, FM 107.1. Joining us this afternoon in this portion of the program has been pre-recorded to accommodate our guest schedule, Dr. Randall Williams. And I'll go ahead and maybe make your day, but a real pleasure. Really, your accessibility, Dr. Williams, has been fantastic, and your aggressive nature in reaching out to the community, not only to me, but also in general, but also the work you've done in these areas. Predominantly right now, we're focusing on, you and I have, our conversation's been on drugs, but there's so many other activities. This is National Public Health Week. We've learned that, hey, the seaports are where it really began. We've got several themes this week. We'll just touch on them very quickly. Violence prevention, and it is coincidental that this is Child Abuse Month as well. Mm-hmm. So let's talk about violent prevention. Are we seeing, sadly, a more violent-prone community, not just here, but I think nationwide?
I think so. I think that if you, certainly part of it is that things that used to happen in California, you just wouldn't know about it. Now you know about them within, breaking news, right, 15 minutes later. So there is probably some amplification of our knowledge of it. But on the other hand, it does seem that people are increasingly prone to violence and violent acts, no matter what the mechanism of them. And again, that's just something that we think it's important to work with our schools. And Richie's been great about this. And how do you build up resilience and character development to keep people from acting out on these aggressive tendencies.
We'll talk about this in a later time, but I also want to bring in, and I'm just going to ask for pretty much a yes/no answer on this one, out of time, constraints of time. I think that the issue of this, unfortunately, the social media, the high intensity of information that's coming to us, I think that's having an influence.
Yes.
Thank you very much.
Sir. Yes, sir.
We both agree on that.
We do.
All right. We'll touch on this one, reproductive and sexual health issues. One of the things that is surprising, and I remember a conversation or a presentation given by Nina Oliver, who is the health director working for you. And she noted that there was an increase in, STDs, sexually transmitted diseases. Interestingly enough, much of it having to do with the sharing of needles.
Yes.
And of course, basically the selling of their bodies to maintain the addiction. But there's another issue that's tangentially connected to drugs.
Absolutely. I think that the ripple effect of drug abuse, whether it's 75% of our prisoners in prisons are there for some reason because of drugs. You mentioned, hepatitis C, which we have a very real issue here in Carteret County with, and the adjoining counties. Incredibly expensive to treat, and has long-term.
Permanent. It's a permanent.
Has long-term sequelae long beyond the use of the drug. So we have a specific team that's just assigned to just that, hepatitis C.
Whoa, we're talking with. That's interesting. We're talking. This, by the way, is a great opportunity. We're encapsulating this in the fact that this week is National Public Health Week.
Yes.
But I think further conversations are in need. We'll jump right into. I really would like to spend a little more time. We've got rural health issues. That's the theme for Friday, and then accessibility on Saturday, and then Sunday food and nutrition. I think they're pretty important. But I want to touch on one other: mental health.
Yeah, absolutely.
We're probably not going to have enough time to get to all of these items, but I think the mental health issue is a significant topic, and I obviously there's a lot of discussion about the role that COVID played in this, and the fact that we were quarantined and we were isolated, et cetera, et cetera. I would contend, just for the fun of it, I think another aspect of this is, again, going back to that social media.
Absolutely. Your intuition is backed up by research. There's some incredibly alarming statistics coming out globally, not just in the United States, but globally, about the effect on adolescents around depression and anxiety and suicidality. And when they look back at it and try to figure out what was the trigger, what changed, it appears that around 2010, the one correlation that looks very concerning is the rise of all the different social message platforms. And again, what fascinates me about that is it's a global phenomenon when you look at depression, anxiety, and suicidality among young people. Again,
the benefit of today's program is to help, quite frankly, me establish some future programs for our conversations. Again, Dr. Randall Williams with us. We've hit several items. Friday will be rural health.
Yes.
Carteret County is not really it is categorized as a rural county, but I contend it's not a rural county. But still, it is an issue. Getting access to those folks who are living distant from, I guess, medical facilities, is that the issue?
Well, we are technically a rural county, but I understand when you look at Terrell and Pasquotank and others, you go, wait a minute, we don't quite look like those. They're more rural. But I've come to believe that if you're at the end of the road, we're a peninsula. So basically, I believe that if you look at counties like Craven that are surrounded by other counties, it puts them in a different environment to me. We're basically at the end of the highway.
We are.
So I think that very much still makes us rural.
So what is the answer to that with rural health? Is it just a matter of we've got to be more aggressive about reaching out to folks?
I think that the key to that is you've got to make it accessible. that I believe the real limitation, and obviously I've done this at 2 statewide levels, is you've got to bring the providers to the people
Right.
and not take the people to the providers. So that's where we're going to head with that.
And by the way, I just want to make mention of this because we didn't say this earlier, but our guest, Dr. Williams, has worked at the state level in North Carolina and also in Missouri.
And headed rural health in both states.
Okay. All right. So accessibility, we touched on, quite frankly, that's the theme for Saturday.
Mm-hmm.
And so I'm going to say that you kind of touched on that. Because I think, or is there more to be said about that?
Well, no, I'm a huge believer, as I think I've told you before, that an old country doctor told me a long time ago when I started medical school that I'd always be judged on 3 things: my accessibility, my affability, and my ability, in that order.
Oh, really?
Oh, yeah. He said, Randall,
accessibility,
affability, and ability. And I said, well, wait a minute. If you're really good and you're really nice, that should do something. He said, nope. He said, if you're not accessible to people, those 2 qualities don't do anybody any good. So you mentioned earlier that I'm accessible. It's because he told me that 40 years ago, and I've never forgotten it. You've got to be available to people.
So all future health directors should have that?
Absolutely.
Okay.
And if they can't do that, then they need to find another line of work.
Then we'll wrap it up with food and nutrition, which kind of goes all the way back to the very beginning because that's a core element relative to public health.
It is. And I think that it's one that we probably has been overlooked with all the else going on between fentanyl and COVID. But certainly in rural communities, we understand that those communities are going to have more problems with diabetes and heart disease and being overweight. And so I think, again, it comes to making sure we can get the services to the people instead of making the people come to the services.
And it goes back to your earlier conversation about the role that, and not to set aside the sheriff, but the high schools and the community college, because it's a matter of education.
Absolutely.
I want to thank Dr. Williams for being with us this afternoon. We're talking about National Public Health Week, several themes this week, as we just started off with community, violence prevention on Tuesday. Wednesday is reproductive and sexual health. And we don't think about that, but there really is some significant problems based on previous stories I've read in the News Times. And then mental health on Thursday. That's a topic I really would like to talk about at full depth as well, because much of that has to do with the impact of substance abuse and violence. So
absolutely.
I mean, that to me could be the one theme for the entire week. But and then rural health on Saturday. Friday is rural health. Saturday, accessibility. Sunday, food and nutrition. And with that, Dr. Williams, thanks for being with us.
Lockwood, thank you so much.
Viewpoints on the Talk Station.